these drug companies and these doctors that are getting paid to do surgeries and getting paid to offer lifetime hormonal therapy.
Well,
So
you're
like there's
you're
a
you're
huge
wrong there.
incentive.
Well, in terms of profit, it actually would be profitable for them to not take hormone blockers, because then you can involve them in the invasive surgeries that are much more expensive than the hormone blockers.
What do you
The
think
current
happens after you do the
consensus
hormone
is to
blockers?
apply the hormone blockers so when they become 18 years old, they can decide whether or not that they want to go through their traditional puberty or if they want to go through hormone replacement therapy. So it would actually make the medical institution more money for them to not take hormone blockers, not the other way around. Nate, you are being invited to speak. How are you doing today?
Good. How about yourself?
Great. Now, you seem to have an issue regarding trans individuals. Is that
Okay.
correct?
Do you want us to each give our position on the issue and then we could talk about it, or do you want to
Sure.
have specific? Okay. So do you want to go first?
Yeah, I mean, I could go first. I believe that being trans exists at a level of biological determinism. And given that it is based off of biological determinism, we ought to treat them as human beings and free of discrimination. I believe in trans affirming care for minors and adults. I don't believe that there should be laws that prevent access to this care. As to whether or not that they should pay for it, that's a completely different discussion. It's not really relevant to the whole trans debate.
So what is okay? Sorry. Go ahead. Yeah. Let me know when you're
I
finished.
believe that trans women by gender are women, but not by sex. But that's where I'm at. Yep.
Transgender. Can you repeat that last part again?
I said trans women are women by gender.
Women by gender. So you're just your definition of woman is a gendered word.
Well, it can be by sex or it could be by gender. It would have to depend
But
on the context of what's happening. But yes,
so
in this exact instance, I'm referring to gender.
so so if trans women are women, then why have the word trans women? Why would you use the word?
hmm
Why would you use the label trans if trans women are women?
Yes, because their gender does not match with their sex.
So do you not think that there's a little bit of a confusion that you create when you use the word trans women to women referring to the biological word women? Are women the gender version of that word?
No, because I am providing a distinction.
But you're not providing a distinction. I don't see how what's the distinction?
Hmm? The fact that gender can be different from sex.
I know, but you're not deciding. You're just making an arbitrary. You're just making an arbitrary distinction between women having two different meanings, gender
Mhm.
and sex.
It is not an arbitrary distinction. It is one that is rooted in neurobiology, the endocrinology, the biology, and the fact that the embryology is also different as well. There's
I agree that woman has a biological definition. I'm just saying it's not a gender definition.
no, it can be.
I when where and what I don't see how it's ever been used that way. That's not what women is used as. Women is used as a biological term, not a gender term.
Gotcha. So let's say, for example, I said the word manly woman. Does that make sense to you?
Manly refers to has a gendered connotation to it. Manly
Right.
has a gendered connotation to it. Woman does not have a
Right.
gendered connotation to it.
Well, so it can have a gendered connotation to it, such as when I say
No, it
trans
doesn't.
woman.
If you said feminine, right? Feminine means like a woman,
Okay.
right? So like a woman is referring to the like the gender stereotypes of being like a woman,
Okay.
right? So that's the difference between that's gender and sex. I acknowledge a difference between gender and sex,
Okay.
but you can't. But to conflate trans women or women is just causing confusion as to what the word women means if you're literally using the word in two different ways in the same line.
hmm Well, I'm saying trans women are women. When I'm saying I'm making the distinction where I say it is on the basis of gender.
So I I just personally disagree with your co-opting of the word women to mean gender. I don't think that that's a fair way to describe women. If you want to have this, I mean, I think it's at this point it's an arbitrary distinction. My
Mhm.
arbitrary distinction is an appeal to just the way we've called women for all of human history, and you want to provide a new way of calling trans women as this gender term of women. And I just don't believe that. I don't think that's necessarily the argument we should be having right now. But
Mhm.
we can just agree to disagree and move to a different topic, move to a different part of the top conversation.
Okay, where do you want
So
it to go?
okay, so so that was your third claim. And your second claim or your second position. Okay, so I just wanted to clarify. You believe in trans affirming care for minors. That's what you
Yes,
said.
that's correct.
Okay. So I'll go ahead and then and I guess do you have can you just list your first position so that I could you said that I just want to be able to know that all your positions. I guess you
Yeah,
just
yeah, it has
believe that.
yeah, being trans operates on the basis of biological determinism. Someone becomes trans because there is a biological imperative that is inherent, and it occurs as early as an embryonic stage.
Okay, so okay, this I think this is a decent position to start. So first off, I'll lay out my position, and then we can figure out the details between our different premises. So my position is that there is a biological implication to being a certain gender. Okay, I don't think we're necessarily aware of those biological implications. I also think that there is a social implication to creating those genders, and to be able to know the difference between those two things is very difficult. And so while I will acknowledge that there are people that that have this sort of gender dysphoria, or people that feel like they're trans, right?
Mhm.
Uh, that isn't actually clear to me that we should treat them any differently than any other person. So I like, it doesn't seem to me clear that there's enough evidence to suggest that any, specific therapy that, I mean, the therapies that come to mind are obviously, there's gender affirming therapy, right? There's the next level of like hormonal therapy, where you expose women to testosterone and men to estrogen, right?
No,
And then there's
that's not
obviously
done
the
on
next level.
minors.
It's not. Then you'd be. I mean, that's definitely done to minors. You'd be wrong.
There are specific instances where they will apply
It's
a
definitely it's definitely done to minors, bro. That's the whole
well, no,
conversation.
you have to understand that the medical consensus is a lot more conservative on this than what you may be led to believe.
Not in America.
For example, if somebody is exhibiting more feminizing traits when they feel that they are a man, and let's say even that they have, the genitals of a male, but they are exhibiting feminizing traits because of some sort of hormonal malady, then yeah, they typically would just provide gender affirming care, right? But in
But
terms of
again, I saw.
if somebody feels like that they are, a woman trapped in a man's body, and they go to a psychologist, they have gender dysphoria, they typically will not give you hormone replacement therapy.
Again,
They
I'm
give
not
you hormone
concerned.
blockers, right? And then when you're 18 years old, you can come to an educated decision or an adult decision as to whether or not that you want to go through with that therapy.
I mean, hormone blockers. That's also a. I mean, that's you're preventing people from their body naturally being, developing the way that it's supposed to be, right? That's how their body is being developed. You're inhibiting. I mean that, and then when you do that, that's generally accompanied with the opposing hormone, right? So if you're stopping your natural production of estrogen, and you facilitate giving them testosterone, that's hormone replacement therapy.
Yeah, yeah, I know. And I'm saying that for minors, they typically don't offer hormone replacement therapy unless if you're
Okay,
talking
but I'm
about
not
some
concerned.
pretty
I'm
extreme conditions. Typically, they
not,
give you hormone
so you're
blockers.
against that. So you're against that.
No, I'm in favor of what is medically efficacious.
Okay, like none of this is medic. There's no evidence about the medical efficaciousness of any of this.
Yes, there
There's
is.
no evidence. No, there isn't.
I can provide you this information. Do you really want to see
But
that?
I can also provide you information that if you took these people that have these gender dysphoria and you had them just, experience life and go through the normal stages of puberty, that in majority of cases their gender dysphoria dissipates. So that's evidence. If people experience gender dysphoria, go through the
Yeah,
natural
well, that's why they
natural
apply hormone blockers to come to a decision.
no, they don't go
Uh,
through normal hormone blockers. People
that's
that just
literally what they
experience
do.
no, I'm saying that there's evidence. This is a study. There are studies. You can Google this. You can ChatGPT this. There's evidence of
Mm.
people that have gender dysphoria that they do not that all they do, right? They don't do any surgeries. They don't do any hormone replacement therapy. They don't do any puberty blockers, right? And then if after they experience a normal puberty, their gender dysphoria dissipates. This is proven. That is actually proven,
Yeah,
right?
this is why I agree with the conservative step that they present, where they offer psychological support, and that's at any age. And
So
usually for,
are you against puberty blockers for minors?
I'm not against puberty blockers for minors at all.
But I'm just telling you that there's
Yeah,
evidence that if minors just went through puberty, that their gender dysphoria would dissipate.
that's not necessarily the case.
Okay, well no, but there's evidence for that.
That is a basis on a case by case basis.
No, it's not.
Right?
It's not case.
That's
It's
why
no.
that's why you should
It's not
talk to
case
a
by case.
doctor about these things, because every individual will be exhibiting different outcomes based on what is happening. If they
I
have
thought we were
severe
following
gender
the evidence.
dysphoria, then yeah, this is the evidence, right? If somebody is going through early puberty, like Tanner stage 2, JNRH agonists will be prescribed to pause puberty, right? That basically
there
buys
any
time
evidence?
to further explore without distress of developing unwanted secondary sex characteristics. Okay, that is what is medically efficacious on the basis of the APA as well as the Medical Association. Even in hell, even the even more conservative, most European countries also apply this as well. That is the
What do you
fact.
mean most European countries? The European countries that I'm aware of that if you look up European countries that have reverted their stance on giving gender affirming care to minors that goes beyond just therapy this has been a retreat in Europe.
They have reduced
They've retreated
their
from this. Only in America that they do that we continue to do this, and it
yeah.
makes sense because in America, when we're a capitalist country, you have these drug companies and these doctors that are getting paid to do surgeries and getting paid to offer lifetime hormonal therapy.
Well,
So
you're
like there's
you're
huge
wrong there.
incentive.
Well, in terms of profit, it actually would be profitable for them to not take hormone blockers, because then you can involve them in the invasive surgeries that are much more expensive than the hormone blockers.
What do you
The
think
current
happens after you do the
consensus
hormone
is to
blockers?
apply the hormone blockers, so when they become 18 years old, they can decide whether or not that they want to go through their traditional puberty or if they want to go through hormone replacement therapy. However, they would likely not need the invasive surgeries such as a mastectomy or
So
fat
what is your
placement
evidence?
or facial reconstruction. None of those things would be necessary if they had hormone blockers. So it would actually make the medical institutions more money for them to not take hormone blockers, not the other way around.
That I disagree. I think that if you're going to go on hormone blockers, right, and then there's an ideology around this. If you believe, okay, I'm actually a woman, and when you're actually a man, and you believe, okay, now I've paused my male puberty, right, and now I want to be identify more as a man, or sorry, as a woman, then I'm going to take those hormones, right? This is a stepping stone. This is like what you're saying is just not true. If people do this in steps, then
What do you think is more
that's what
expensive,
happens.
hormone blockers for the next 5 years, or do you think invasive surgery such as facial reconstruction is more profitable?
What profitable for who?
The
Probably different
doctors.
people. Different people are getting paid different things. The doctor may get some cut from the um uh from the hormone recommendation prescription from the drug company. But the doctor's probably getting money for doing the surgery, and the hormone and the companies that that give money for the research are the ones that to try to prove that this is good, are the ones making money off of the hormone replacement. So there's different incent. Both people are aligned with providing these things, and they're aligned. They're aligned. If you do the hormone
Okay,
replacement
so
therapy,
then
you're
why aren't
eventually going to do the surgery.
why aren't the ones that apply surgery, why aren't they lobbying for like stopping hormone blockers, so that way that they can get more surgeries?
No, why would they? No, they no. It would be contrary to the ideology. They want people to
Well,
be
the
more
answer to this
medically.
is actually quite simple. The reality is that there is no ideology. It's just what is considered medically
It is
efficacious.
okay. Again, you're just saying it's medically efficacious, but you don't.
Well,
You're not,
it
you have
is.
no measurement. You have no
I
measurement for
do.
what you're
That's
saying.
the medical
Can I
establishment.
you have to. You cannot reference medical efficaciousness if you
Yes, I
have no
can.
standard. Can I? You're just interrupting me, saying no, but I'm telling you how you're wrong. You keep saying no, there is, and I'm telling you that you're wrong. Let me explain how you're wrong. You have to be able to give me a standard for measuring how this could ever be efficacious. I gave you information. I told you that there are studies that tell you that
Okay.
that people that have gender dysphoria, experience gender dysphoria, the same people that you would want to give hormone replacement therapy to potentially, or other gender affirming care that's more serious. You just said that, or sorry, I'm saying that if those people experience normal puberty, that their gender dysphoria for most of those people would disappear. What information would you take in to be able to falsify your position? I gave you evidence contrary to your worldview on this
Well, you
matter.
gave me your statement, but I'm going to go ahead and provide you evidence. Give me
I
a
can
moment.
provide you evidence.
Here we see puberty blockers for transgender and gender diverse youth. This is off of the Mayo Clinic. Puberty blockers can be used to delay the changes in puberty of transgender and gender diverse youth who have started puberty. The medicines most often used for this purpose are called gonadotropin releasing hormone, or GnRH analogs. Here is a summary of their possible benefits, side effects, and long-term effects. When taken regularly, GnRH analogs stop the body from making sex hormones that includes testosterone and estrogen. So the sex hormones primarily affect your primary sex characteristics, such as sexual organs present at birth, penis, scrotum, testicles, uterus, ovaries, vagina. Secondary sex characteristics are the physical changes in the body that appear during puberty, which could include breast development as well as growth of facial hair. So in people assigned male at birth, GnRH analogs...
What is this? What is this? This doesn't
This is the
look
Mayo
like a study
Clinic.
to me.
Yeah,
Doesn't look like it. This isn't a study though.
Well, there's
Show me
numerous
evidence.
studies.
This isn't
Sure.
an evidence. This is
Well, if I could
Mayo
just finish
Clinic.
this.
Yeah. Well, where's the study?
Well, I'm pulling up the Mayo Clinic.
I understand the
This
Mayo
is
Clinic
this is the current
has a
medical
position.
efficacy.
They have a position on this. What
Yes.
evidence do you have for this position?
Sure. Let me see if I can provide you the exact evidence,
I have
even
evidence
though
telling-
that the
I have-
Mayo Clinic is literally telling you that it is.
There's
We didn't
no-
even
that-
get to the. Well,
That's a
we did
conclusion.
not
This is a
even get to
conclusion
the.
with no evidence.
Yes.
Do you
So we
understand the
can go
difference?
over. We can go over the actual evidence. We're perfectly okay with doing that. But let's go over it, right? What are the possible benefits of puberty blockers? Gender identity and the internal sense of being male, female, or neither, or some in combination of both. Gender dysphoria is a feeling of distress that can happen when gender identity differs from a person's sex assigned at birth or from sex-related physical characteristics. Some transgender or gender diverse people experience gender dysphoria, others do not. For transgender or gender diverse youth who have gender dysphoria, delaying puberty might improve their mental well-being, ease depression and anxiety, improve social interactions with others, lower the need for future surgeries, and ease thoughts of actions of self-harm. Taking puberty blockers alone, however, without other medical behavioral treatment might not be enough to ease gender dysphoria. So the criteria for use of puberty blockers is in most cases, to begin using puberty blockers, an individual needs to show a lasting pattern of gender nonconformity or gender dysphoria, have gender dysphoria that began or worsened at the start of puberty, address any psychological, medical, or social problems that could interfere with the treatment, and be able to understand that the treatment and agree to have it. This is called informed consent. Puberty blockers are not recommended to children who have not started puberty. In most cases, youth aren't old enough to get medical treatment without a parent, guardian, or caregiver's permission. This is called medical consent. For those who have not reached the age of medical consent, a parent, guardian, or caregiver often needs to agree to the use of puberty blockers. Parent and family support is encouraged, has been shown to be an important part of boosting mental health as well as well-being throughout this treatment. Are the changes permanent?
I understand this is your... Are you understand that you believe these things? I understand that I understand that this is a conclusion that you believe in. I'm asking you,
sure.
What is your evidence? What is your evidence for this? Because I can give you evidence saying that there is that gender dysphoria desists after you experience a normal puberty.
I don't even necessarily disagree with that. I've even read the studies that you're referring to. That's perfectly fine. But that would argue on the basis of a case-by-case basis, which, fair enough, that would just ultimately be you need to talk to the psychologist, you need to talk to the doctor. But this doesn't say we should ban we should ban hormone blockers on children.
Okay, first off, I've never listen. There are normal utilization of those things, right? When you have someone that has maybe, this is like an extreme scenario, right? When you have someone producing way too much testosterone or way too much estrogen, I'm sure there's medical conditions for that. Those are what that's typically utilized for, right? That's what it's been utilized for. And it's also in traumatic cases been used for sterilization. Okay? We've used those same hormone or those puberty blockers drugs to sterilize people, right? So sterilization is a potential implication if this is misused.
Yes, that is a discussion that ought happen between the doctor and the patient and the parents. I don't believe it ought be up to a politician who doesn't know anything regarding this subject.
Okay, but first off, we are all, I mean, as the body politic, right? We can have a conversation about the basics of this information. This is not that complicated of an issue, okay? You are simply, what did you just do just now? You cited Mayo Clinic conclusions.
Yes.
I asked for evidence. I told you contrary evidence to the presuppositions listed
what
in
you
the
argued
Mayo
was
Clinic.
Not a contrary. I conceded to your point that yes, there are people that grow out of it. That's fine. That's why I'm in favor of using a medically efficacious method, which would be to go through psychology, and then it would be a case-by-case basis, because you're talking to a psychologist and a doctor.
Okay, that just because you talk to a doctor and a psychologist doesn't mean it's medically efficacious. This is like, what standard are you using for measuring efficaciousness? You're using this word efficacious.
Yeah.
And efficacious means effectiveness in a way of doing something.
Yeah.
If you do not have a way to tell me how it's efficacious, you don't know what the word efficacious means. So I'm trying.
You're saying that something isn't efficacious on the basis that, like, who should I talk to? Like Joe or you or
no. I could tell you. I could say, hey, we have a study here. A study is looking at kids that have gender dysmorphia, right?
Dysphoria.
We're assessing, gender dysphoria. So if they have gender dysphoria and they go through a normal puberty, right? We can see, okay, after we measured 10,000 kids, right? 85% of them after experience the gender dysphoria dissipates. So that seems to me pretty efficacious.
That would be a case-by-case basis.
You're saying case-by-case basis. I'm telling you.
And here I have another study: pubertal blockade and subsequent gender-affirming therapy. True, and unrelated. Would you like to go over this?
Okay. Say what is the claim?
This is the National Library of Medicine from the NIH.
Okay. What does the article say?
We'll take a bit, but we can go over it.
We can just read the abstract here real quick.
It's a long abstract.
You're just pulling it. Okay. So what is? I mean, do you have any idea what this is?
Yeah.
Okay. So can you summarize it?
Yeah, it's basically saying that there's a lot of bias that is occurring right now, specifically by right-wing media groups, in order to demonize it, and actually doesn't argue it on the basis of actual medical efficacy.
Okay. So you're
And
saying
then it
that this
also proves that
article.
they can find contrary research to this study.
So you're saying that this article is saying that the bias of other studies is is just wrong. There's a bias. That's the purpose of this article.
So there is some level of knowledge that we can operate on, which is fair, right? I agree with you. There probably are an X amount of people that can grow out of it. And what I would want is a rigorous method of going through a psychologist, confirm whether or not that they have gender dysphoria. If they have gender dysphoria, then it may be necessary for that person to take pubertal blockers.
So you acknowledge that there are people that have gender dysphoria that can grow out of it. You acknowledge the evidence of the study that I mentioned. You acknowledge this fact.
Yeah, that can happen. Sure.
Okay. So then, how would you differentiate between people? Now I would like to know your methodology, because you acknowledge that there are people that those people, they shouldn't go on the puberty blockers, right? They shouldn't be going down this trans rabbit hole because they will grow out of it, right?
Not all people are like that.
No, I understand, but some people, and a majority
Yeah,
of
so
people,
talking to your doctor, having
Okay,
conversations about this,
so
and
I'm-
then if they feel that they are not good for that, then get off of hormone blockers.
well, again, that's going on the hormone blockers. You are starting a whole process. A person. Is it possible a person who experiences gender dysphoria, right, that would normally grow out of it, given your way of doing things, of going on these puberty blockers and going on hormone replacement therapy, do you think that is it possible, right, that even though they would grow out of it, they might feel good doing it your way in the short term? Is it possible?
Sure, it's possible, but that's not all
Okay,
people.
so then tell me how, if you acknowledge that it's possible, that the people with all the metrics that we would be able to measure, these people who would grow out of it, that we can't differentiate, that if they do your prescribed unnecessary treatments,
Nope,
would
that's not
potentially
true.
feel good about it.
Gender dysphoria
What?
can be pretty bad on people, and it can be so bad that it
I didn't
increases
say-
overall suicidal ideation.
I didn't.
And so it would be important to reduce to reduce that from happening. And that's
I
the current
understand
medical
we shouldn't
basis
let them
is
kill
to
themselves.
operate. Yeah, it's the current basis is to operate on least harm possible. That's what the medical system in the
And
United
I'm
States
saying that
operates on.
and I'm saying you're contradicting that.
No, I'm not. I'm saying
I'm
we
saying your
have a
position
person who
contradicts
has
that.
gender dysphoria. I take them to a psychologist. Yep, the gender dysphoria is pretty severe. We should get them on hormone blockers. Would you agree
Okay,
with
so-
giving somebody a minor hormone blockers? Are you in favor of a minor taking hormone blockers?
No, I'm not in favor of my
Okay,
taking hormone blockers.
so-
Because I just told you
Okay, so let
that
me ask you
minors
this.
that experience normal puberty will grow out of gender dysphoria.
Okay, so let me ask you this. There are children who get precocious puberty, right? Women, they'll
Yeah.
8, 9 years old, they'll start growing breasts, and boys, they start getting really, really tall and 8, 9 years old. It's often very, very embarrassing, right? And it also leads to a lot of complications. So what often doctors prescribe is hormone blockers, and then to get off of hormone blockers when it is time for puberty at a normal age. So that way they can live a relatively normal life.
Yeah, I
Right?
told
You
you.
were-
This-
you
this
were
is a
against-
This is a scenario that exists. This is a scenario that
so-
exists.
so
that
you
is
said you
it is
were
a fringe
against-
scenario.
Okay, but that doesn't matter. It exists.
It does matter.
You said you were against hormone blockers, right?
No, I was against
For
hormone blockers
minors-
for gender dysphoria. You said gender dysphoria.
Okay, so you believe that we should discriminate of having access to gender affirming care under the basis of sex, right?
No, it's not. It's not. That isn't the basis of sex.
Really?
The basis would be that you gave two scenarios. One, basically puberty too early from at a normal age, right?
Yeah.
And then another scenario is a person feeling like they're the other gender,
Yeah.
right? and then putting them down this rabbit hole of encouraging them to be the opposite gender, right?
Yeah.
So those are completely different scenarios.
Yeah, on the basis of sex.
It's not the basis.
It's a
No,
discrimination on the
sex.
basis of sex.
It's not the basis of sex, because they could both be
Well, it is.
They could both be different sexes. They could both be either sex. Both scenarios could be either male or female. There's no discrimination on sex.
Here's the problem. If you have somebody who says that they have gender dysphoria as a minor, they should not be taking, so that means that their gender is different from sex. And you are saying, no, you are not allowed to take hormone blockers under the basis that your gender is different from your sex. But if you are the opposite sex, you could take hormone blockers. Is that correct?
No, that's not. No, it has nothing to do with sex.
That yes, it does. That's literally.
Tell me.
That's what that is.
I'm telling you.
You're arguing on the basis of discriminating people on the basis of their sex.
You're wrong. I'm not saying that.
Well, unfortunately, that's what it outputs.
I can reiterate it again, because you're clearly misrepresenting what I'm saying. You gave two scenarios. Scenario one, a person has is it called precocious puberty? Is that what it's called? Or pre-puberty? Okay, they have experiencing pre-puberty. Another person is experiencing gender dysphoria. Both people, right, could be male or female, right? In one scenario, I'm against it. In another scenario, I'm okay with it potentially.
Yeah, on the basis of sex.
It's not basis of sex. How is it the basis of sex?
Yeah, because if they are the opposite sex, as in their gender now matches their sex, then you'd be okay with that. But if their gender did not match sex, then it would not be okay. Yes, it is.
It's not a matter of the sex. Why would you keep saying this?
Because that's what it sounds like to me.
Maybe stop playing your game and listen.
I'm not playing a game. I'm listening to you. I can hear you.
You're playing a game right now.
Yes.
If you literally can't understand the basics between two different scenarios, and you're playing a game, and I'm telling you you're wrong, maybe stop playing the game and listen, because you're clearly not taking this seriously enough. I'm telling you
listen
that it's not a discrimination of sex at all.
I understand you don't think it is, but it is.
You have. Okay, type it out in ChatGPT and tell me if your logic's correct, because I'm pretty sure the LLM will be able to tell you that I'm right. So we can do that right now.
I don't know what.
Let's do an exercise. Let's articulate your
What do you
idea,
want me to type in ChatGPT?
Okay, I'll even type it out. I'll share my screen.
Go ahead.
Okay, let's share my screen and let's see if ChatGPT agrees with my characterization of this position.
Okay. I don't see how ChatGPT though would be like inherently.
You think it's not capable of basic logic?
I mean, I'm sure it is capable of basic logic. I have argued on the basis of basic logic right now.
No, your basic logic is wrong, because I am not discriminating on sex. I'm discriminating on the
you would be, because in an instance, if their gender does not match their sex, they're not allowed to take under the basis of their gender matching their sex.
Two different diagnoses.
You've said that you should not allow the treatment of gender dysphoria with hormone blockers, but if they were the opposite sex, as in their gender now matches their sex, then it is appropriate through precocious puberty. So your logic doesn't follow.
Because you're implying that the person who's the opposite sex is just experiencing precocious puberty. You're conflating the two scenarios.
Well, I've already actually got you to contradict yourself. Actually, just earlier, because the problem is that
you're gonna deviate. You're gonna deviate.
We're just gonna repeat over the same thing. Like we just agree to disagree here.
Because I just told you that because this is not a disagree to disagree. This is a logical.
Well, you are also against hormone blockers for minors, but then you're not against hormone blockers for minors when it comes to precocious puberty.
Because of a distinction in the diagnosis.
Yeah, but the current medical efficacy of hormone blockers is quite clear and already quite conservative in its position.
Right? You acknowledge, you're deviating. You acknowledge that I am not saying it's a distinction between sex. It is a distinction between the diagnosis.
I know you're saying that it's a distinction between the diagnosis, but I'm saying that you're using it operating on the basis of, you're operating under the basis of a discrimination on sex. Yes, it is.
It's not tell me how, if
a
person.
What is your treatment for somebody? What is your treatment on somebody with gender dysphoria?
I mean, I'm not a doctor. My treatment
I'm asking, what would you do?
Follow the basic study.
Follow the studies?
I just told you.
Okay, because the current studies right here are specifically to apply hormone blockers.
You just asked me a question. I'm telling you my answer, and you're interrupting me when I'm referencing studies, right?
You haven't
So
referenced a single
are you?
study, but I'd be glad if you link it in
I
side chat. I can go ahead and provide it and
oh,
show it to
right
everybody,
here,
and we'll
bro.
go
Right
over
here,
it.
dude. Right
All
here.
right, go ahead
It's
and provide it. That'd be
linked in
great.
chat right now. So
Fabulous.
tell me how, if there's evidence that people who experience gender dysphoria have their
Let me read
gender
this
dysphoria.
study out. We're going to read this study together.
This is just once. This is the first study I pulled up.
Okay, yeah, we're going to read it together. Desisting and persisting gender dysphoria after childhood, a qualitative follow-up study. The aim of this qualitative study was to better obtain a better understanding of the developmental trajectories of the persistence and desistance of childhood gender dysphoria and the psychosexual outcome of gender dysphoric children. 25 adolescents, male age 14 through 18, diagnosed with gender identity disorder, DSM-4, DSM-5T, 4. Yeah, 4TR. Why are they using the 4? Never mind. Okay. In childhood, participated in this study. Data, how old is this? 2011. Okay, whatever. It's fine. Yeah, I was just curious why they're not using the DSM-5. Participated in this study. Data were collected by means of biographical interviews. Adolescents with persisting gender dysphoria persists. For those whom gender dysphoria remitted, as in desisters, indicated that they consisted of a period between 10 to 13 years of age to be crucial. They reported that in this period, they became increasingly aware of the persistence or desistance of their childhood gender dysphoria. Both persisters and desisters stated that the changes in the social environment, the anticipated and actual feminization or masculinization of their bodies, and the first experiences of falling in love and sexual attraction had influence in their gender-related interests and behavior, feelings of gender discomfort, and gender identification. Although both persisters and desisters reported a desire to be the other gender during childhood years, the underlying motives of their desire seemed to be different. So basically what this study is telling me is that it depends. Which would be congruent with what I've understood.
No, you're wrong. It's telling you that after experiencing normal human development, your position on gender dysphoria changes. That's what that says. If you can't read that, you have no critical thinking. That's basic. Read what it says.
Both persisters and desisters reported a desire. Yeah, no, it's saying it basically
during the
depends.
Early childhood years and the underlying motives of their desires.
Why don't I go ahead and we'll do it in your favorite ChatGPT, right? We're just going to ask, break this down for me. To better understand how and why childhood gender dysphoria continues or persists or goes away, desists as kids grow up, it either continues or it goes away. To explore psychosexual outcomes, things like sexual orientation and gender identity of those kids as they become teens, 25 adolescents were studied. All had been diagnosed with gender identity disorder in childhood. Though biographical interviews, teens were talked about their life experiences. The key findings is between 10 to 13, this is when both persisters, where the gender dysphoria continued, and desisters, those whose gender dysphoria went away, so they really began to realize if their gender dysphoria would stick around or fade. So influential factors during this period was social changes, as in how others treated them, body changes like puberty-related feminization or masculinization, first crushes or experiences of sexual attraction, and these are things that impacted their gender-related behavior and feelings, including discomfort and identification. And then the common childhood experiences of both groups remembered wanting the other gender when they were younger, but the reasons that they wanted were likely different. Yeah, so my critical thinking is perfectly fine. I read the study just fine.
If your critical thinking is not letting you deduce from that information that people who experience normal puberty have their dysphoria dissipate, then your whole worldview falls apart.
There are people who dissipate, and I agreed with you. I conceded that point.
So if a majority of people who experience gender dysphoria dissipate, then what criteria are you using?
It doesn't say that in your study.
I sent you another article.
Gotcha. All right, we can look up another article
Kenneth
now.
Zucker, about 80% of children do not consider gender dysphoria into adolescence.
Okay, let's take a look here. Where is this study? Let's take a look.
First two studies I just looked up with a Google search or a ChatGPT search, brother. Pretty easy information to
Gender
access.
identity disorder entered the psychiatric nomenclature in the DSM-3 in 1980. The article reviews 3 domains of empirical research on gender identity disorder in children and adolescents, diagnosis and assessment, association with psychopathology, and developmental trajectories. Okay, let me see if I can Sci-Hub this. Just give me a moment. I'm just linking what you said right? That's
Here's
it.
another one. Here's
Okay.
another. This is
So
the same. This is the same
what
article.
portion do I need
This
to?
is the same article.
What portion do
This is
I
the
need
same.
to go over? Okay, where do I need to go? Okay, I'm looking
Just
at
look at just.
the brief overview.
I mean,
Okay, let's see.
read
Yeah,
the
the brief
abstract.
overview seems okay. So the study of gender identity disorders in children and adolescents began 45 years ago with a seminal paper by Green and Money in 1960. Over this period, the field has attracted only a small number of researchers, perhaps reflecting a relatively low prevalence of GID when compared with other conditions that affect children, such as attention deficit hyperactivity disorder or anxiety disorders. The number of clinicians with extensive experience in the field is also rather modest. At the time of this writing, there are, to my knowledge, only 3 specialized gender identity clinics worldwide for children and adolescents, one in Amsterdam, recently relocated from Utrecht, one in London, and to my own clinic in Toronto. In contrast, there have been many more specialized gender identity clinics for adults, although the number of university hospital-based programs has dwindled, particularly in North America. Research on gender identity disorders, however, have profited from the advances in allied areas, including studies of normative gender development, sexual orientation, and physical intersex conditions. When one takes into account
this brief overview, or do you want to just ask ChatGPT what the brief overview is? Because I don't think that you need to do this. ChatGPT is great at summarizing information. You can ask ChatGPT what is
sure.
what is the result of this study, or you can, and I can
Sure.
also cite with you again
Sure.
the abstract of the study,
What?
which is in the chat now.
Summarize this. Research into gender identity disorder began 45 years ago, starting with a key paper by Green and Money. The field remains small, likely due to the low prevalence of GID compared to more common childhood of ADHD or anxiety. At the time of writing, only 3 specialized clinics exist: Amsterdam, London, and Toronto, while adult clinics are more common but declining, especially in North America. The concept of gender identity was introduced in the 1960s by Hooker and Stoller, with Stoller defining core gender identity as a child's basic sense of belonging to one's sex. Cognitive developmental psychologists like Kohlberg later built on this, framing as a first step in understanding gender constancy. Gender identity isn't just cognitive, it has emotional significance too. Children often strongly identify with their gender and show bias in favor of their own. Despite this, early developmental research largely overlooked emotional, affective aspect, though the clinicians have long recognized its importance. The term gender dysphoria emerged to describe individuals deeply unhappy with their biological sex, seeking transition. It became clear that children, not just adults, could experience this deep distress. Cool.
So I don't even know.
Another study that argues my point.
So brother, all you said.
You got another one. Let's pull it up.
First off, I don't know what you copied and pasted into ChatGPT. Okay.
Oh, here. If
Second
you look
off,
right here,
second
if you look right
off,
here,
all you
please
said
observe,
is that gender
right?
dysphoria-
I basically grabbed
can I
from
respond to
your
what you just said?
paper without the paywall. If you want without paywall, here it is, right? It's
So
literally your exact study,
how about you ask
right?
ChatGPT?
Your exact study, and then what I did is I scrolled down to the brief overview. Well, you're asking where you got it, so I'm presenting it to you, right?
Can I talk now?
And so you can see right here, this is what I highlighted and what I presented, right? Your study does not argue your position.
Can I talk now? Can I talk now?
Sure.
Okay, thank you. So all you read from that study, from that brief overview, is that gender dysphoria exists. Did I deny that gender dysphoria exists?
No. So why are you linking?
What straw man are you arguing?
Oh, well, because you linked a study saying a thing that the study doesn't say or argue. So when I read and then I realized that it doesn't argue what you are saying that it argues, and then I show it to your face because I actually do my homework, then all of a sudden you're caught with your pants down. So I'm going to ask you very simply, please provide me the study that gives you an argument that actually argues against the medical efficacy. I'd love to see it.
Just copy and paste a small segment of it. Ask ChatGPT to analyze the study based off of the title of the study. This is basic searching. I'm going to ask ChatGPT, gender disorder in children and adolescents by what's his name?
I would actually love
Kenneth
it if you streamed your
by Kenneth Zucker. What is the conclusion? Yeah. Okay, so let's go ahead. I'm going to share my screen now because I don't know, this is just so difficult.
McLovin is saying using AI here as an authority is hilarious. I agree. This is hilarious.
It won't let me share my screen. So you have to let me share my screen. You have to give me permissions to share my screen.
Why don't you just like take a picture of it or something and send it over?
I asked ChatGPT, gender dysphoria in conclusions. What does this mean? I'm posting it in chat right now. It says my message is too long. I'm gonna message it to you. Let's see if this. Okay, I just sent it to you. So I asked gender dysphoria, a disorder in children and adolescents by Kenneth Zucker. What is this conclusion of the study? It says a significant percentage, about 80% or more of children diagnosed with gender dysphoria no longer experience it after puberty. That's the conclusion of the study. That's how you're supposed to do research with ChatGPT. You don't just randomly select a segment of the study.
The summary? Maybe we're looking at different studies. Can you link the study? Because I feel like we're probably linking two different studies here, right? Because I grabbed the study that you presented, but I have a feeling we're probably talking about two different studies. Can you please just repost the study that you're referring to?
The title of my study is the one that I just copied and pasted in the chat. That's the title of Gender Identity Disorder in Children and Adolescents by Kenneth Zucker. That's the title of the study. That's the title right there.
Where?
In the beginning of the message.
Can you just post the link?
Dude, this is the name of the study.
Repost the link.
Well, are you going to look at your DM right now, or do you want me to send it again?
Yeah, this is the same one that I managed to pull with using Sci-Hub, which was able to give me the entire study, right? And then when I brought up the brief summary and gave the study.
No, the brief overview that you read, the brief
on the basis of what the actual study says.
Can I talk?
Also, just FYI, right? We're talking about some stuff regarding the DSM-3 since 1980. Right? You understand that we are on the DSM-5 right now? We're a little bit more updated on gender identity disorder among adolescents.
Brother, it's evidence. It's a 2008 study.
Okay, the problem is that what year is it? It's 2025, right?
A 2008 study.
Right now it's 2025, right? So you're talking about a very old study on a topic that is largely being discovered almost on a yearly, on a monthly basis, new things discovered. And we're going to be referencing. Yeah, that's a very old study. I can provide very recent studies that show the opposite of what you're saying.
It's not a very old study.
That is an old study. Comparatively speaking, if you're referring to gender identity disorder, like they don't, just FYI, right? They don't even use the word gender identity disorder or the phrase gender identity disorder anymore. They refer to gender dysphoria because they realized that there was a difference between the actual negative aspects of being trans as in the gender dysphoria as opposed to being trans in and of itself. So when they realized that, they basically called it gender dysphoria as in the negative feelings that you feel being the opposite sex of your gender. And so they basically remove the idea that being trans in and of itself is a disorder.
Okay. I don't want to get into the weeds with you on whether or not you think this is too old. My only thing that I want to draw from this is just a second study that I Googled within a minute, right?
Mm-hmm.
So if there's evidence, the point is that if there's evidence that people who experience gender dysphoria, right, will grow out of it, right? And this study suggests 80% or more, right? Then
I've already conceded to you that it is possible that people grow out of it. That doesn't mean, therefore, don't do any gender affirming care.
Can I ask the question?
It also doesn't mean that, therefore, don't use hormone blockers.
You're just interrupting me before I can ask the question.
I just don't agree with you here, and I'm presenting to you why I do not agree with you and what the medical efficacy is.
How can you disagree with me if I haven't even asked I'm just asking a question. What are you
the statement that you made prior, I disagree with your statement.
What statement did I make?
I disagree that you're saying that gender identity disorder is even a thing. First of all, it's gender dysphoria, right? I disagree with that.
I never said it wasn't a thing. I never said it wasn't a thing. Did I say it wasn't a thing?
Okay, so if we're referring to gender dysphoria, I'm going to ask you plainly. Do we use hormone blockers to take care of minors? Is there any medical efficacy of using hormone blockers on gender diverse youth?
Gender diverse, using a different word now.
Trans children.
So people that have experiencing gender dysphoria, that's you're saying. Yes. Is there any efficacy to and how would you measure efficacy?
Doctor.
Again, I've asked this question before.
Doctor.
That a doctor isn't
We would use
methodology for
we would use the
a doctor
DSM-5 on the criteria
a
for
doctor-
gender identity disorder. I will pull that up as well.
So a psychologist says that your child is trans, right? So what is
No,
so
the
that's your
psychologist
methodology?
doesn't care whether or not you're trans. The question is whether or not that they have gender dysphoria.
What is your methodology for determining that this dysphoria is not going to dissipate after puberty?
Oh, that would
You
be
have no
you would have
methodology. You
no.
have no
You would just talk
methodology.
to a psychologist to
You just-
determine
exactly,
whether or
that's
not
not
you
methodology.
exhibit
You see-
symptoms of
you see,
gender
you're-
dysphoria.
I'm trying to have a discussion about how the doctor is going to diagnose, and you're just saying the doctor. You are having an argument of an appeal to authority to the doctor.
No.
I'm asking for, yes, you are. I'm asking for how is the doctor going to determine that this child is not going to continue to experience gender dysmorphia?
All right. Well, first of all,
You
it's
need to
not
have
gender
evidence.
dysmorphia. It's gender. Yeah, I'm presenting
Or
it to
gender
you.
dysmorphia.
Right.
What is it called? Gender dysphoria?
Dysphoria.
Gender dysphoria. Dysphoria. I'm sorry. If I make the name wrong, I'm not trying to be rude. I'm just gender dysphoria.
So here we go. We have gender dysphoria in children. So a marked incongruence between one's experience or expressed gender and assigned it gender, or at least 6 months of duration, as manifested by at least 6 of the following, one of which must be criterion A1.
Dude, I'm
One
not
is a
disagreeing
strong
with you
desire
about-
to be
what are
the
you
other
reading?
gender.
What are you reading?
This
What are
is
you
the
reading right now?
DSM-5's criterion distinction of whether
For
or not that a child has
diagnosing
gender
gender
dysphoria. Yes.
Okay, but what is the question I asked you?
You asked
Can you
me,
repeat the
what is the evidence or what do you do to determine that somebody has gender dysphoria? And I said,
No,
yes.
no, it's
what
not
we
what I
do
asked.
is we
That's not
look
what
at
I
the
asked.
DSM-5.
That's not what I asked.
Then what is your
That's
question?
not what I asked. I asked, how would you know if this gender dysphoria would not continue after puberty?
You would ask them. You would have subsequent visits with the psychologist.
So after puberty, you can ask the psychologist?
Yeah, if it starts to
after puberty-
dissipate,
so we're-
then you get them off of
after-
hormone
so
blockers.
we're not gonna,
yeah.
so we're no.
Yeah,
This is- No.
yeah.
Brother, the purpose of the study is to measure people who have not experienced gender dysphoria, who have experienced gender dysphoria and are not doing outside things like puberty blockers. They're just experiencing the normal puberty. If you affect people by disrupting their puberty, how could they possibly know, based off the evidence I provided you, that their puberty would not continue? If you interrupt the thing that's naturally going to result in them not having the gender dysphoria by stopping it with the puberty blockers,
Unless
how could
it
they get out of
doesn't.
it? How could they get out of it?
Unless
The point-
it
no,
doesn't.
I gave you evidence. I gave you evidence.
Yeah,
that there is
and the evidence says
Right.
sometimes it doesn't go away.
80%. So the point is this: 80% of the time. 80% of the time.
That would mean it's a case-by-case basis,
No,
Nate.
listen. Okay, listen. If 80% of the time, the gender dysphoria. Listen. I'm gonna start from scratch. I acknowledge gender dysphoria exists.
Okay, let me
So
just
you looking
hold
at-
on.
you-
Let me
no,
try
let
it
me-
this
let me-
way.
let me- No,
Let's
no,
try
let me
it
talk,
this
let me
way.
talk. Let me
No.
talk. Let me talk.
I've let you talk
Brother,
plenty.
brother,
You're
no,
going to
dude,
pause for
you're
a
the one
second.
trying
You're
to
going to
read gender
pause for a second, Nate.
DSM-5.
You're going to pause
You're
for a
trying to read
second,
the
Nate.
DSM-5.
I want to test your epistemology. Okay.
Brother, you're the one with the
Let's
epistemology
say
issues here.
80% of children are not allergic to pollen, but 20%
Brother, we don't need to
are.
give an analogy.
And
We
let's
need
say
an
that we
analogy
go
for this.
through. Let's say no. Let's say
You're
that we
arguing
go.
from analogy. I don't
Let's
need- I
say
don't need
that
to
we
argue
go
from analogy.
through. Let's say what I'm doing is I'm challenging your epistemology.
arguing
I'm
from analogy.
challenging your
I
worldview.
don't care
right?
about
right.
arguing from
So
analogy.
let's say, for example,
Argument
that
from analogy is a
that
weak
they go
argument.
through puberty. Let's say that they go through puberty, right? And then 20% of them continue to have to be allergic to pollen, but 80% don't.
So
Should the
what- okay,
20% just stop taking? Should they stop taking because they're the minority?
Listen, brother. You are so confused. First off,
No, I think you're
let's not-
confused.
Can I, let me talk.
I'm arguing it on the basis of a
Can
case-by-case
I
basis,
talk
and
now?
because
Can I
it's not a
talk now? Can I
majority
talk
to
now?
you, you therefore
talk
think that
now?
it shouldn't be applied on any.
I talk
And
now?
so, under your
No.
basis, if 20% of
Can I talk
people
now? Let me know when I can
needed a
talk.
specific drug, then
Let me know when I can talk.
then we should just deny them, even though they legitimately need that drug.
Okay, I'm trying to determine the legitimacy. You clearly seem to have a mental block in your head as to determining a methodology for when a person with a dysphoria, right, after they experience, if most people, 80% of people who experience gender dysphoria and they have a normal puberty, nothing to do with puberty blockers. They're not taking puberty blockers. If they experience a normal puberty, then the result is that 80% of them have no more dysphoria. The dysphoria dissipates. So
Yeah, but
you
that's
have to
not true
provide.
for all of them. Your own study shows that. So then you would apply using hormone blockers on those people still.
Listen, can I finish talking?
You
Can I finish
paused.
talking? No, I'm not done.
Okay, go
I'm literally
ahead.
trying to iterate my point. So if the 80% of people, right? If the 80% of people who are fine afterwards, if it was inappropriate for them to take the puberty blockers early, right?
Yeah. Okay. So if they are taking yeah, it wouldn't have been bad that they are taking hormone blockers when they didn't need to. I agree.
Okay. So 80% of people if 80% of people that experience gender dysphoria, if they go through a natural puberty, don't need the puberty blockers because their natural puberty will alleviate their gender dysphoria, right? Then how could you possibly justify giving people who don't need puberty blockers? You have no methodology to differentiate between people.
Yeah, you do. You use the DSM-5
What's the methodology?
and you diagnose them
No, listen, that is not
based off of
a
the
methodology.
criteria of the That is a methodology. That is exactly what they do.
No, dude, the DSM-5 is just a list of diagnosis processes. What is the diagnosis processes that you are going
It
to
tells you
distinguish?
the criteria
So what is the
directly,
criteria then?
and you
No,
have to
then
have those
tell me-
criteria.
there is no criteria,
Yes,
brother.
there is.
There's no
Let's
criteria.
okay, let's do the criteria one more time. And you are not going to interrupt. We're going to go through the
I'm
entire
asking the question
criteria.
now.
No,
I'm
you
gonna ask
asked.
the question.
I
I'm
want the
asking the
criteria, so I'm giving you the criteria,
the
Nate.
criteria for something very
Shut
specific.
up.
Very
Shut up.
specific.
Shut
Very
up. This
specific.
is not
Very
TikTok.
specific.
Right? This is a
Very
discussion
specific question.
between two people
Very
who has
specific
completely
question.
different ideas, and you asked for the specific
let me ask my
criteria
question.
of what we do to determine somebody being gender
Repeat my
dysphoric, and you're going to
question.
listen to the
Repeat my
entire
question.
thing.
Repeat my question.
So we have a marked
Repeat my
incongruence. I'm
question
not playing
then,
this
first
game with you.
offender.
A marked
If you can't repeat
incongruence
my question,
between
then what are you
one's
doing?
experience and expressed gender and
can't-
assigned
you're just
gender at
talking
least
to
6
not-
months duration
this is
as
you're
manifested by at least
You're
6 of the
filibustering.
following,
You're
one of which
filibustering.
must be in criteria. You asked for the
filibustering.
criteria. We're going over the criteria.
For what though? For what?
Gender dysphoria, whether or not that they
Hey,
continue to
no,
exhibit
not
gender
just
dysphoric
dysphoria.
symptoms through
Not
gender
just
gender
dysphoria.
affirming care, such as hormone
Not
blockers,
just
right?
gender
You
dysphoria.
asked, what do we do to determine that they are no longer? That what do you do when they are no longer when they don't actually need the hormone blockers? They just grow out of it. How do you know?
How do you know?
And I said, yes,
Yeah.
you use the DSM-5. You talk to the psychologist
How?
and
Tell
determine
me how
what
you use it,
criteria.
because there
Yes.
is no
So yes,
evidence. There
it
is
is.
no
Yes,
evidence.
that's when you use this criteria. Okay.
Okay, so
you
give me-
have to
so
have
there is
first of all, you
currently
must
zero
have criteria
evidence.
A1, which is a strong desire to be the other gender or an insistence that one is the other gender or alternative gender different from one's assigned gender. In boys,
done.
in assigned gender, a strong preference for cross-dressing or simulating female attire, or in girls, a strong preference for wearing only typical masculine clothing or strong resistance to the wearing of typical feminine clothing. There is a strong preference for cross-gender roles or make-believe play or fantasy play, a strong preference for the toys, games, or activities stereotypically used or engaged by the other gender, a strong preference for playmates of the other gender in boys or assigned gender, a strong rejection of typically masculine toys, games, and activities, and a strong avoidance through rough and tumble play, or as in girls, assigned gender, a strong rejection of typically feminine toys, games, and activities, a strong dislike of one's sexual autonomy, a strong desire for a primary and or secondary sex characteristics that match one's experienced gender. And then B, the condition is associated with clinically significant distress or impairment of social, school, or other important areas of functioning. There are some certain specifications where if in a disorder of sex development, such as congenital adrenal disorder, such as congenital adrenal hyperplasia or androgen insensitivity syndrome, could also be prevalent. So now that we know the criteria, basically you have an instance where there is a child, right? They get on hormone blockers. Let's say they matched, right? So we get them on hormone blockers, and then, I don't know, a year or two goes by, and then all of a sudden they don't feel that the same way. Very well. Get them off of hormone
Brother,
blockers. It's that simple.
Brother, you haven't given me evidence to say that a person who is experiencing gender
What is the
dysphoria,
DSM-5?
Can I talk? Are you going to keep it talking?
I don't need to give you evidence. This is the DSM-5. This is the criteria that is used to determine mental determine mental disorders. What do you think the DSM-5 is?
Oh, you're calling it a mental disorder? You're calling gender dysphoria a mental disorder?
Yes,
okay,
it is.
Okay, so I thought it was biological, bro.
That also is true.
Okay, I'm just teasing you. I'm being a little facetious here. I'm sorry. So, I would also call it a mental illness. I was just being facetious. So this is the point that you don't understand, brother.
I don't think you understand.
Are you going to interrupt me? Or are you going to keep interrupting me when I'm
talking? I'll let you finish up, man.
So I let you read your criteria. Okay. You are reading the criteria for diagnosing gender dysphoria. Did I say gender dysphoria doesn't exist?
You never said that.
Okay, so I acknowledge gender dysphoria exists. That criteria can be useful for recognizing gender dysphoria. Okay? I acknowledge that our criteria is useful for recognizing gender dysphoria. But you also acknowledge that there is a subset of people who experience gender dysphoria who will grow out of the gender dysphoria after experiencing normal puberty, not taking puberty blockers, right? So how do you know which kids will do fine without the puberty blockers?
They talk to the psychologist. How do you know? You don't know. You don't know. You go to the psychologist. There's no way to know. You go to the psychologist, right? And then when they no longer exhibit symptoms of gender dysphoria, you get them off the drugs. That's how that works.
Dude, you don't understand. 80%. I'm going to repeat this again because you keep sneaking in there. You get them off the drugs. If they're not on the drugs at all.
Yeah. What about for the 20%?
Yeah, they're not on the drugs either. So
okay. So they just kill themselves. Got it.
Brother, the idea that you would imply that the only solution to this gender dysphoria feeling is to take this magic drug is just not a.
No, that's not what I've argued at all. I've not argued that even in the slightest.
You just said that they should just kill themselves in a facetious way because
for the 20% that legitimately need it.
No, I do not.
Also, you need to cite your 80%.
How do you know they need it?
You need to cite your. Oh, because you use the criteria of gender dysphoria.
No, there is no evidence.
Yes, there is. That's in the DSM-5 today. That's the current. Distinction of having gender dysphoria.
I asked you though earlier in the conversation. Is it possible that someone who, given normal puberty, would not experience or would stop experiencing gender dysphoria if they had gone on your regimen of puberty blockers? Could they possibly fit in to this success or what is this efficacy? This efficacy of puberty blockers. Almost certainly, yes. There is a confirmation bias in just doing anything to try to solve a problem that you think you have. So that is not evidence in my mind to say that 20% that hey, you take this drug, you're going to feel better, right? If you just say that to a placebo, that's also going to be the case. That isn't evidence of efficacy, brother. Okay, you acknowledge.
I'm citing the DSM-5. I honestly don't know what else to tell you at this point.
Yeah, exactly. Your DSM-5 is not sufficient to be able to solve the problem.
It is. That's what's currently used, and that's what the medical efficacy is.
I'm saying it isn't. There is
so I'm
going
to give you I'm going to give you the last word, and then that's going to be it. But I appreciate you coming in to call today. I'm going to
say First Amendment. I'm going to ask ChatGPT. Let's ask ChatGPT. Is there evidence? Or I'm going to ask ChatGPT. Given this conversation. Right, your position is give the because there's 80% of kids that need it, or they don't need it, but 20% do, right? So we got to give them all the drugs. That's your implication of your worldview. My worldview is we don't have a way to understand who to give these drugs to. You're trying to say let's do puberty blockers to kids that are gender dysmorphia when 80% of them don't need it. And you have no way of discerning between who needs what. So how could you ever justify giving hormone replacement therapy or or uh, or puberty blockers to a kid if you don't know they're just going to grow out of it? It's an unjustifiable position. That's my position.
Okay.
And we have no counter to that.
Well, I give people the last word and then we move on. Anyway, I appreciate you for calling in.
Okay, though, I wish you had some.
Woo! That was interesting.
Man, that was painful.
What did you think of that? What did you think of that, Daniel?
Well, first of all, I find it very strange that somebody that holds these very strong opinions doesn't know the terminology in the first place. I mean, I would assume at least you know the terminology of the thing you're willing to discuss about. Secondly, I feel like using ChatGPT, I think it can be a useful tool, but it's not a replacement for somebody's brain and their ability to actually reason and actually read and understand the study. I don't think he understands how to read studies. He was referencing studies that were like extremely old, right? We've gotten way further since 2004 and 2005. Like his studies were not even referencing like the proper DSM categories, and I don't know. It's just like a bunch of nonsense, like general right-wing weirdness, I think. And he's just regurgitating the same old bullshit that everybody's, spewing on the right. He kept saying it's like 80%. I don't know where he got the 80% from. Yeah.
Yeah, I mean, none of his
just
studies even
nonsense.
referenced that, and they even asked him to provide that. And when I pulled up the actual study
tell you where.
itself, like he couldn't substantiate
No, I can
that.
tell you
So
where.
I thought
Because he
that was
asked
very
ChatGPT,
strange.
and ChatGPT gives you like a lot of false information too.
Yeah.
So it's like if you don't actually check
anyway,
to see
we
what's
have-
happening in the study.
We have so many people that want to join in.
Let's all go to the lobby. Let's all go to the lobby. Let's all go to the lobby to get ourselves a treat.
You're on the line with First Amender. How are you doing today?
I'm great. It's Penguin, and I just have to say, I tried calling when you were arguing with Nate, and I wanted to say that anecdotally, I can say that having been on HRT for over almost 2 years now has been the best decision of my life and has greatly improved my life in many ways.
Well, you must be a part of that 20%, and you really shouldn't exist, according to Nate.
Nah, I mean, I find it strange that some people really want to impede people's life goals when it comes to because like the HRT thing was mainly just like it opened my eyes to how I could really feel about the world around me and how I should feel about myself, which is great. The feeling of being alive. Like, I don't know why that pisses some people off. It's a mystery to me. And I don't understand why some people feel like they need to prove themselves right by disrespecting others. I find that to be a very strange concept.
No, I completely agree with you. This is why I find consistently that I am fighting in favor of trans people, especially in an age where transphobia is so pervasive. It really is one of the most ultimate NPC arguments ever. Like, there's so many transphobes out there, they can't think for themselves.
And I also find it strange that these are also the same people that like to critique my health so much when I'm also much better shape than them, and also like actively eating better than them and being proactive
No,
about.
you're
like,
not
my
supposed to
sleep
look
and stuff
good.
like
How
that.
dare you? Don't look good.
Yeah.
No looking good.
Yeah, but I mean, I don't understand it. I really don't. But I do feel like, honestly, in probably 20 years, this is going to be one of those discussions where it's like, oh yeah, remember when we used to hate trans people? That's
Yeah.
a joke.
No, I totally agree with you. I do believe that it will go in that direction for sure. 100%.
Because, I mean, that's what happened with, like, women's rights. It's what happened with African Americans' rights. It's what happened with, like, a bunch of other minorities' rights. The only way I could see that being undone is if, like, some dictator came to power, I guess, or something like that. I don't know.
No, it's not the same. It's not the same.
Yeah, but Nate's not on the stage no more, so that's unfortunate. But yeah, I just wanted to call and say that.
I try to give people the last word, let people, say what they want, and then that'll be that. I mean, obviously, I don't believe that we were in a going to be coming to any consensus anytime soon, because to me it seemed pretty obvious, but I can see why. I don't know. I guess he got stuck on it. I don't know.
But
I
yeah,
appreciate it.
that's all I have to say.
Yep. Sounds great.
Bye.
Bye-bye.
Hey, first, I'm doing great. I just want to talk about a little bit about the whole gender dysphoria thing. So, are you familiar with Steamza? Thomas
Steamza?
D. Steamza.
No, I'm not. Why don't you tell me?
Okay, so that was the author of the paper that the guy was like referencing. So it was so he's getting that whole like 80% number from that paper. So it's actually a range. It's from 60 to like 95% or something like that. But like most people average it to like 80 or whatever. So that paper is not a good paper for many reasons. I'm pretty familiar with it, but basically, it uses an outdated version of the of gender dysphoria definition.
Yeah, it uses
As you
gender
noted,
identity
Ashley.
disorder, which is basically talking about trans people and it being a mental disorder. Obviously, the DSM-5 has moved past that, which I tried to illustrate to him, but he just wasn't interested in hearing that. He just was stuck on it. Well, he was like, well, ChatGPT says I'm wrong. Which, by the way, ChatGPT, if I just asked it specific questions, would tell you he's wrong, which is kind of weird that he would go that far. Just strange.
So and there's many issues to the study. So it uses other studies, right? That studies people with gender dysphoria back when it was known as GID, and most of these studies are really old. Like they're from the 70s and 80s, actually, and none of the studies have the updated definition in DSM-5. And then get this, one of these studies isn't even a study, it's a book, and it's called The Sissy Boy Syndrome and the Development of Homosexuality. I'm
Wow.
not joking.
That's
I'm not
wild.
joking. It's not even a study, it's a book.
That's wild.
And that's not about trans people, it's about homosexuals. And then he also mentioned Zucker. I'll be honest, I haven't read Zucker's study. I have read Steema's papers because like Steema, he's one of the most referenced people for like transphobes. They really love Steemsa. But like Zucker, I haven't read his work, but that's a guy you need to look out for because he basically is a huge advocate for like conversion therapy for trans people.
Nice, sick.
So he's a very well known
That definitely works, I'm sure.
Oh yeah, like it's pretty horrible. But yeah, I would have liked to talk to Nate just because like I've actually read this. I think you did a really good job just like talking about like reading it through and everything. But yeah, Steemza, Zucker, those are like researchers you gotta look out for. I'm talking about like gender affirming care and stuff like that.
But hold on, wait. I don't understand. What are you telling me that I'm sorry, I'm blanking.
No worries.
Anyway, did you have anything else for me?
No, I'm good. Thanks for having me on though.
Oh,
I guess
no, I got it. I'm sorry. I apologize. Are you telling me that I can't let ChatGPT do my thinking for me?
No, like as a researcher, I would be careful using ChatGPT to draw conclusions about stuff. Like it's useful, don't get me wrong, but like I wouldn't like if I'm debating someone, I would never reference ChatGPT for something.
No,
like,
I
there could
wouldn't
be
either.
so many problems with it. Like it's just I don't know. It's cringe. I really do cringe when because I've heard so many people during debates bring up ChatGPT. I mean that was like Rob Noah's whole like scandal with Destiny. That basically he didn't read like a certain paper. He actually just used a ChatGPT summary of it.
That's wild.
but-
This is why I've been like taking more time and care to just pull up the study and then read it as is, which is so bizarre because like I read it out loud and it's like, hey, this is what it means, and then like they said, no, you clearly your reading comprehension is way off, and so we believe that you're wrong here. Put it in ChatGPT and it literally argues exactly what I thought it would say, which is what I comprehended. And I was just like, and now what? And then he had to move the goalpost. I mean, it was several goalposts moving. It's just wild that how far people have to go to just like deny the existence of trans people. It's crazy, or rather, deny care to trans people is the problem. Yeah.
Well, I'd rather take someone that actually reads through what the literature says and what the ChatGPT summary of it, because there could be so many issues with how it summarizes. Because even these AI systems are known to have a certain bias towards them because of the people who designed them. So
Yeah.
keep
Anyway,
that in mind.
it's good talk, man. I appreciate you.
Yeah.
I might include you in the video.
Thank you. Have a good night.
See ya.